not easily seen on this skull, unfortunately. But there are two lines, coming along. So there's an inferior temporal line. That'll work. You kind of see the second one faintly.
Thanks, Nick.
So, oh, Elmo, you are the bane of mine.
Yeah, right there. Yeah.
So you can see there's an inferior line going across, and then there's a superior line up here. Anyway, if we wanted a line, we put out a skull that has it very nicely on it. You can see both lines. Remember, the inferior temporal line is the attachment point for the temporalis muscle. The superior line is the attachment point for the temporalis fascia. Okay? And then we go back to this guy. So we've already done masseter, temporalis. So if we come down here, here is the lateral pterygoid plate. So the lateral surface of the lateral pterygoid plate is the origin of the inferior head of the lateral pterygoid muscle. The superior head will take its origin from this right here. That's the infratemporal crest going right across there, as well as some of the greater wing of the sphenoid bone. So greater wing of the sphenoid bone, infratemporal crest, right here. That's the superior head of the lateral pterygoid muscle. So again, make sure, it's going to be very important that you read cards on these things, because it could be that we've got, two arrows pointing right here, saying identify the bony structure indicated by the arrows, and we would want, say, infratemporal crest. Versus if we have a strip of red tape across here that said identify the muscle that has an attachment, or identify the muscle that takes an origin from here, you're going to say superior head, lateral pterygoid. So it's always important to read cards very carefully. Okay, so the last one for at least the muscles of mastication is medial pterygoid. And medial pterygoid has three different origin points. One is going to be the medial surface of the lateral pterygoid plate. It's also going to take some origin from, this area right in here, which is the maxillary tuberosity. And then here is the palatine bone. This structure right here, coming off from it, is the pyramidal process of the palatine bone. So pyramidal process of the palatine bone, some of the maxillary tuberosity, and some of the medial aspect of the lateral pterygoid plate is the origin of medial pterygoid. All right? So that's your four muscles of mastication and their origins. They got to be coming off from somewhere other than mandible, because they're moving the mandible. All right, so let's do some other muscles. Hopefully, everybody realizes this is the styloid process. The styloid process has three muscles and one ligament, I can say two ligaments that I'll have you know, one more important than the other. So styloid process is going to have stylohyoid, stylopharyngeus, styloglossus muscles taking origin from it. It will also have the stylohyoid ligament and the stylomandibular ligament taking origin from it. So two ligaments, three muscles coming off from the styloid process. Here's the mastoid process. Mastoid process is going to be a point of insertion for the sternocleidomastoid muscle. And if I kind of tip this up a little bit, just inside to where the mastoid process is, this structure right here is called the digastric notch. You might see it called digastric groove. This is a point of origin for the posterior belly of the digastric muscle. Okay? So there's digastric. There's sternocleidomastoid. Now, if I tip this and go and look kind of inside a little bit, let's zoom just a little. If I tip this just a bit, I don't know how much we've talked about this, but there's always a good thing to know. There's always one person that really likes this one a lot. So there's a little bump. That's blurry, I know. there's a bump right here on the occipital bone that's called the pharyngeal tubercle. That is a point of attachment for the superior constrictor muscle of the pharynx. Okay? So remember, pharyngeal tubercle, superior constrictor muscle. Now, looking at it from this view, here is lateral pterygoid plate. Let me focus this a little bit. Okay, so out here is lateral pterygoid plate. Right here is medial pterygoid plate. Here's the pterygoid hamulus right here. So in here is a spot that's called the pterygoid fossa. I don't know if it's still on your list or not, but if it is, it's the fossa between the two pterygoid plates. And then working your way posteriorly from it, this is a really nice deep one. You'll see right here is a spot that's called the scaphoid fossa. Scaphoid fossa is just kind of anteromedial to where foramen ovale is. Here's ovale. There's spinosum from this view. So spinosum, ovale, here's scaphoid fossa. All right? If this is spinosum, just posterior to it is this little bony knob right here that's called the spine of the sphenoid. So, spine of the sphenoid is going to have a muscle and a ligament attaching to it. The muscle attaching to the spine of the sphenoid is tensor belli palatini, because what happens is with tensor belli palatini is it comes from the spine, has an attachment along the scaphoid fossa, then will come up to the pterygoid hamulus, wrap around, meet the other tensor raphe. So, coming from spine of sphenoid, scaphoid fossa, up the hamulus, and wrapping around, going back to the other side. Okay? Tensor belli palatini. Now, the other thing that has an attachment to the spine of the sphenoid is the sphenomandibular ligament. The sphenomandibular ligament is coming from the spine of the sphenoid and going to the lingula of the mandible. Remember, remnant of Meckel's cartilage from development. I won't be able to show it from this view, but if you look at a disarticulated temporal bone and you see the bony auditory tube, remember there's a muscle that has an attachment point to, really, insertion point onto the bony auditory tube, and that's the levator belli palatini. Tensor goes as attachment to the membranous portion. Levator belli palatini is attached to the bony portion of the auditory tube. Okay, what else from this view, muscle-wise? Okay, you know that posteriorly, look at it however you want to look at it. Here is the external occipital protuberance. Boy, this goes back a long way, doesn't it? Our good friend, the trapezius muscle. I would just remember about the external occipital protuberance. Yes, it goes to the nuchal lines, all that kind of stuff, but just know that. You're also going to remember about it being a Ceph landmark, or something like our good friend Enion. But remember, it's all about, if I put a piece of tape here, or an arrow, it's all about, does the card ask for Ceph landmark, or does the card ask for bony structure? Don't get external occipital protuberance mixed up with the Ceph landmark there. It's all about what the card asks for. Okay? All right, let's go through. Let's see, is there any other muscle that I've forgotten about? Anybody think of a muscle I didn't do? I guess that's a no. Okay, let's talk foramina and contents. All right, so let's do cranial nerves first and how they exit the skull. That should be pretty easy. Oh, actually, hold on. Let me do, there's some other attachments we need to know. I just thought about that looking here inside the skull. So we learned about some dural attachments. Okay, so let's talk just a few things for dura mater. So remember, we learned that the falx cerebri had an attachment anteriorly to the frontal crest and the crista galli. So it came from here, made its little wrap around, and then posteriorly it attached to, get out of the way, this knob right here the internal occipital protuberance. Okay? So up and around. You know that tentorium kind of attaches along the petrous portion of the temporal bone, kind of about where the groove for the superior sagittal sinus, groove for the superior petrosal sinus is. Okay? And then these structures here, these are the anterior clinoid processes. There's one posterior clinoid process. It's broken on the other side. But the clinoid processes, they're all part of the sphenoid bone, and they're attachment points for the diaphragma sella. It's huge. Okay. That's all I can think of for now. If somebody thinks of something I forgot, let me know.